Welcome to the Psychology and Physical Training channel. Have you ever pondered why it is critical to secure client information in the field of counseling psychology? In a world where information is power, the confidentiality of client information is paramount in the sphere of psychology. To know that, let's see the importance of securing client information in counseling psychology. This is not just about discretion. It's about establishing a bond of trust between the client and the psychologist. When a client knows that their information is secure, they are more likely to open up, to share, to dive into those deep corners of their psyche that might hold the key to their well-being. Moreover, maintaining confidentiality isn't just a good practice. It's a legal and ethical obligation for professionals in this field. Breaches can lead to severe consequences, including legal actions and damage to the professional's reputation. So, securing client information transcends the realm of mere privacy protection. It is an essential brick in the wall of the therapeutic relationship, a cornerstone of effective psychological practice. Securing client information isn't just about protecting privacy, it's about building the foundation of a therapeutic relationship. And next topic is the methods of securing client information. Now, let's delve into a real-life example to better illustrate the methods of securing client information. Imagine a psychologist, let's call her Dr. Jane. Dr. Jane meets a new client for the first time, a young man battling anxiety. As they embark on their therapeutic journey, Dr. Jane must ensure the safety and confidentiality of her client's information. The first thing Dr. Jane does is document the client's history and current symptoms in a detailed case history. This includes the client's personal, medical, and mental health history. Dr. Jane writes these details down on paper, but she doesn't just leave it lying around. Instead, she secures these documents in a lockable cabinet, accessible only by her. Next, she uses a psychodiagnostic test to better understand her client's mental state. These tests can provide vital information about a client's mental health, but they also hold sensitive information that needs to be protected. Dr. Jane ensures that the test results are stored securely, along with the client's case history. Now let's talk about communication. In the modern world, much of our communication happens digitally. This is no different in the field of psychology. Dr. Jane uses encrypted email when communicating with her client, ensuring that their conversations remain confidential. She also uses secure video conferencing tools for online sessions, which are becoming increasingly common. So far, we have looked at how Dr. Jane secures physical documents and digital communications. But what about the information in her head? As a psychologist, Dr. Jane holds a lot of sensitive information about her clients in her memory. She must also protect this information and ensure that it does not get shared inappropriately. This is where professional ethics come into play. Dr. Jane adheres to a strict code of ethics, which includes maintaining client confidentiality at all times. In addition to these steps, Dr. Jane also takes precautions when disposing of client information. When it's time to discard old documents, she doesn't just toss them in the trash. Instead, she uses a crosscut shredder to ensure that the documents cannot be reconstructed. Similarly, when deleting digital files, she uses secure deletion methods that permanently erase the information. Lastly, Dr. Jane keeps herself updated on the latest security measures and regulations in her field. This includes attending workshops, reading professional journals, and participating in peer discussions. By staying informed, she is able to continually improve her methods and ensure the best possible protection for her clients' information. As we have seen in this case study, securing client information requires a meticulous and comprehensive approach. It's not just about locking away files or encrypting emails, but also about maintaining ethical standards, disposing of information responsibly, and staying informed about the latest developments in the field. Whether you're a psychologist like Dr. Jane, or anyone dealing with sensitive information, these principles can guide you in ensuring the security and confidentiality of your client's information. And next, we see the role of diagnosis and testing in securing client information. Diagnosis and testing are crucial parts of a psychologist's job, but how do they intersect with securing client information? Imagine the brain as a complex maze, with each person's maze being unique. As psychologists, our job is to navigate these mazes, using diagnosis and testing as our compass and map. Yet in doing so, we stumble upon secrets, fears, hopes, and dreams. all of which are sensitive information that need to be safeguarded. Confidentiality in diagnosis and testing is paramount. It's akin to being handed someone's diary and being trusted not to share its contents. In fact, the American Psychological Association's Code of Ethics mandates that psychologists maintain the confidentiality of clients' diagnoses and test results. Now let's delve into the world of testing. It's a world filled with diverse tools, ranging from personality tests to cognitive assessments. These tests can reveal a wealth of information about an individual, including their cognitive abilities, emotional functioning, and personality traits. However, they also come with limitations and cautions. For instance, tests are not infallible. They can sometimes yield false positives or negatives. Moreover, testing can be a double-edged sword. While it provides valuable insights into a client's psyche, it also reveals information that could be damaging if misused or mishandled. This is where the importance of securing client information becomes even more pronounced. As psychologists, we are not just tasked with interpreting the results of these tests. We are also entrusted with protecting this sensitive information. Remember, the diagnosis and test results of a client are more than just data. They are private pieces of someone's life story. Each one is a puzzle piece that forms part of the broader picture of an individual's mental health. And just as you wouldn't want someone scattering your puzzle pieces, we must ensure that our clients' pieces are kept safe and secure. Diagnosis and testing are not only tools for understanding a client's mental state, but they are also avenues through which we must protect a client's privacy and confidentiality. And next topic is the non-test methods of securing client information. Beyond testing, there are other methods psychologists use to secure client information. In the exploration of the human mind, testing is but one tool in the psychologist's toolbox. Interviews, observations, and case histories form part of the non-test methods employed to secure client information. Each of these methods provides a unique perspective, offering deeper insights into the client's psyche that a test might not reveal. Let's start with interviews. Interviews are an invaluable resource for psychologists, offering a direct line of communication with the client. The conversation can be structured or unstructured, depending on the psychologist's approach. Regardless of the format, interviews require a careful handling of client information. Confidentiality is paramount. Information gleaned from these conversations must be stored securely and used responsibly. Observations, on the other hand, provide a less intrusive method of gathering information. Psychologists can observe a client's behavior in a natural setting or a controlled environment. These observations can reveal patterns or behaviors that might not surface in a testing or interview scenario. Again, the same principles of confidentiality and secure information handling apply. Case histories are an amalgamation of various information sources, including but not limited to medical records, psychological tests, interviews, and observations. They offer a comprehensive view of the client's history and current situation. This wealth of information is a goldmine for psychologists, but it also comes with increased responsibility. As with the other methods, securing this information is paramount. Each of these non-test methods provides valuable information that contributes to a more holistic understanding of the client. They offer additional layers of understanding about a client, but they also come with their own set of responsibilities. The information gathered, whether through a formal interview, casual observation, or a detailed case history, must be handled with care. In the end, securing client information isn't just about protecting privacy. It's about respecting the trust that clients place in psychologists and honoring the intimate nature of the therapeutic relationship. Non-test methods offer additional layers of understanding about a client, but they also come with their own set of responsibilities for securing client information. And now we shall learn about characteristics and limitations. Let's recap the main points about securing client information in psychology. We've traversed an informative journey, exploring the critical aspects of protecting sensitive client data, which is the bedrock of trust and confidentiality in therapy. We started by understanding the significance of securing client information. Remember, this isn't just about legal compliance or professional ethics. It's about creating a safe space for clients to open up, to share their stories, their fears, their dreams. It's about nurturing a therapeutic relationship that hinges on trust, respect, and confidentiality. Next, we delved into the methods of securing client information. We highlighted the importance of case history, a rich source of nuanced insights into a client's life. But we also underscored the need to handle this information with care, to protect it from misuse or inadvertent disclosure. We then discussed the role of diagnosis and testing in securing client information. We emphasized that while these tools can provide valuable insights into a client's mental health, they also come with limitations and require careful interpretation. We also touched on the types and cautions to be observed when using tests in counseling situations. Following that, our attention shifted to non-test methods of securing client information. We examined how observational techniques, interviews, and other non-test methods can offer valuable perspectives on a client's situation. We also re-emphasized that these methods, like all others, must be used with discretion to ensure client information is kept secure. In conclusion, the task of securing client information is multifaceted. It requires a blend of various methods, a keen understanding of their strengths and limitations, and an unwavering commitment to client confidentiality. It's an intricate dance between gathering information and safeguarding it, between understanding a client and protecting their privacy. Remember, securing client information is not just an obligation, it's a cornerstone of the therapeutic relationship. And if you feel this video is helpful, do not forget to like, share, and subscribe to the Psychology and Physical Training channel. Thank you for watching.